The treatment of type 2 diabetes should be comprehensive and includes diet, therapy, physical activity, the prescription of medications that lower blood sugar, and in some cases, insulin therapy. It is necessary to normalize your lifestyle, which means completely giving up smoking, including passive smoking, abstaining from alcohol, normalizing body weight. The body mass index should be less than 25, treating comorbid conditions, and combating physical inactivity, that is engaging in active physical exercise. Sports, moderate exercise under doctor's supervision and taking into account any accompanying health conditions. Diet therapy is one of the main methods for treating diabetes mellitus. It is necessary to avoid sweet drinks and stop using sugar. Sugar can be replaced with sugar substitutes such as xylitol, orbit, or fructose, but the total amount should not exceed 30 grams per day. It is important to avoid flour-based dishes as well as polyunsaturated fatty acids and easily digestible carbohydrates. Recommended foods include potatoes, pasta, vegetables, and fruits, which should make up 50–60% of the diet. Fish, meat, kefir, and eggs should account for about 15% of the diet. Saturated fats, milk, cheese, animal fats should not exceed 10%. Physical activity is an important component in the treatment of type 2 diabetes. Physical activity should be moderate and carried out under a doctor's supervision. Taking into account any accompanying conditions, it helps normalize body weight, enhances the hypoglycemic effect of insulin, and also improves cardiovascular function and normalizes lipid metabolism. Regular physical activity is necessary at least 3 times a week, with each session lasting at least 30 minutes. Swimming is also recommended 1–2 times a week. However, if blood glucose levels are above 13–15 mol, physical activity is not recommended. Similarly, if there are accompanying diseases such as ischemic heart disease or other heart defects, physical activity is also not recommended. Engaging in sports. Medication therapy is the main method of treating diabetes mellitus. In the treatment of diabetes mellitus, blood sugar-lowering medications are used, and in some cases, insulin therapy. Blood sugar-lowering medications work primarily through several mechanisms. There are several pathways. The first is either stimulating insulin production by the beta cells of the pancreas, or the second type of medication, which reduces the uptake or absorption of glucose in the intestines. The treatment method is also chosen individually by the doctor. Under no circumstances should you prescribe medications for yourself, as the severity of the disease, blood glucose levels, accompanying conditions, and body mass index are all taken into account. In some cases, insulin therapy may be added, particularly when blood sugar lowering medications are ineffective or when there are already many complications from diabetes. The complications of diabetes mellitus include micro and macroangiopathies, that is, damage to the blood vessel. This includes damage to the retina, retinopathy, damage to nerve tissue, polyneuropathy, and damage to the cardiovascular system. Also, of diabetes mellitus. When treating type 2 diabetes, it is very important to pay attention to any accompanying condition. That is, it is necessary to normalize blood pressure if there is arterial hypertension, or to pay attention to ischemic heart disease and lipid levels. In other words, in cases of dyslipidemia, it is necessary to prescribe the appropriate medications. This will improve both the life expectancy and the quality of life of a patient with diabetes mellitus. Type 2 diabetes is a chronic disease that at present cannot be cured. However, by using rational glucose-lowering medications, in some cases insulin therapy, adhering to a diet and engaging in physical activity, it is possible to maintain long-term control of diabetes without allowing it to become decompensated. In this way, the level and quality of life of patients are preserved and complications can be avoided.